In combating with the recent outbreak of meningitis, you will discover that vaccination remains the main and most effective means of combating with this infection. We will be looking at other preventive measures, but I would like to highlight the different vaccines that is required, stating the age and schedule as well as the infection they are being given against. First on my list is MMRV vaccine. 2 doses of this vaccine is given to a child of 12 months and 18 months, and then it combats the infection of measles, mumps, rubella, and chickenpox. Another vaccine required is 6-in-1 vaccine. As the name implies, 6-in-1, it tackles 6 infections, and these include tetanus, whooping cough, hepatitis B, polio vaccine, Haemophilus influenza type B, that's Hep B, and as well as diphtheria, and is given at the ages of 8 weeks, 12 weeks, 16 weeks, and 18 months. Then you also have pneumococcal vaccine, and this covers for pneumococcal bacterial infections like meningitis that we are facing now. And then it is given at the ages of 16 weeks, 1 year of age. A single dose is offered to adults aged 65 years and above. Then we have MMRV vaccine. 2 doses are required for it to give the effect needed. And this is given at the age of 12 months and 18 months. And it covers for measles, mumps, rubella, and chickenpox. Then finally, we have MenACWY vaccine. And this offers protection against 4 types of bacteria. And these are all meningococcal groups of bacteria, including group A, C, W, and Y, and is given to teenagers. Considering the fact that meningitis can be quite challenging when it comes to its treatment, it's easier to prevent it than to get treated when you are infected. Owing to the recent outbreak of meningitis, this video is intended to highlight the different measures you can implement to keep yourself, family, friends, and loved ones safe. Before talking about the preventive measures, I would love to give a brief overview about this condition, talk about the causes, talk about the mode of transmission, the signs and symptoms, the treatment, and finally I'll talk about the preventive measures. In order to fully understand what meningitis means, you need to know what is meninges. Meninges are the protective membranes that covers the brain and the spinal cord. Meningitis occurs when these membranes are infected. You may ask, what age group are really affected with this infection? As a way of answering that question, I will say there is no particular age for this infection to occur. However, it can affect mostly babies, young children, teenagers, and even young adults. The causes of meningitis can either be viral or bacterial. For the bacterial cause, it is rare to occur, but it can be quite detrimental to health, and its treatment is difficult as compared to the viral origin. The viral one is most common and least severe. Now let's look at the mode of transmission. Meningitis is usually spread by people that are not actually sick. These people have this infection, either the viral or the bacterial infection, and it's settled in their throats and nose. So if they cough, sneeze, or even kiss, there is tendency for you to contact this infection. The people that are actually having the meningitis symptoms may not actually transfer this infection as compared to those that are not exhibiting any symptom. So that's why this is quite dicey for everyone. The following people should take more precaution as they are at higher risk of contacting this infection. They include babies and young children, teenagers, young adults, older people, and people living with aggressive condition like HIV/AIDS, or people undergoing some medical treatments like chemotherapy that can suppress their immune system, even pregnant women. Apart from vaccination, there are other measures you can implement to prevent or keep yourself safe during this outbreak. And these include good hygiene, healthy lifestyle, avoiding close contact in outbreaks, prompt medical attention. If you discover you're experiencing any of the above symptoms I've mentioned, it's important to seek early and prompt medical attention. Finally, prophylactic antibiotics. This is usually administered to people that are known to have been exposed to people that already have this meningitis. In conclusion, I would say awareness during outbreaks is essential. So do well to share this video to your loved ones, friends, and whoever you feel will benefit from this knowledge in order to stay safe during this outbreak. As you can see, the cases are increasing by day.